Today, our Dean of College of Biomedical Engineering are with us. So we will discuss about the SWOT analysis from Bhutan's group. And after that, we're going to go for the pain points that leads to the problem solving. So right now, I think that I saw Bhutan 1. And are you ready for the presentation for your SWOT analysis? Are you ready?
Yeah, madam. Yes, madam.
Okay, so you can share your screen and just start for your presentation, please.
Yeah, sure. Is my screen visible, madam?
Start.
Okay. First of all, my greetings to everyone, and our apology for not being able to present yesterday because we are occupied with some official works. And this is group 1, and our topic is about like introducing telemedicine in remote areas in Bhutan. First of all, I'd like to share briefly about my department and how my country is. So in my department falls under the Ministry of Health and National Medical Services. And in my country, since it is like, it's a very huge landlocked and mountainous country, it is a bit difficult for people to, travel from one places to another. And usually it takes like more than a day to reach from one places to another places. So that's why we thought of like taking up this topic to present for SWOT analysis. And for SWOT analysis, our topic is telemedicine in remote areas in Bhutan. For strength, we have included as a healthcare access expansions, because due to the very large distance between one place to another, it becomes like very difficult for a patient to have a proper healthcare, access to proper healthcare. That's why if Bhutan happens to introduce such systems in remote areas, it will be a very great, helpful to the patients. And also because of the mountainous area, it will be very cost saving for our patients, because usually when people travel from highland area to the capital, they normally have to like hire a chopper to travel during a winter season because of the blockage of roads with the snows and all. So it will be a very cost effective measure for the patients. And also a quality of care by specialists will be like governed, because right now in Bhutan, since it's a developing country and there is not so much development in healthcare, and if we happen to introduce this, it will also enhance the quality of care by the specialists to each and everyone of the citizen. And it will save time for both the patients and healthcare providers. And on 5th, we have like facilities. We will have a facility for continuous monitoring and recovery with the storage of data. And for the weakness, we have like infrastructure limitation, like no electricity and intranet in remote areas because it is very mountainous and landlocked. That's why it is not readily accessible. And also because of the very low rate of literate people, it is like difficult for illiterate people to use smartphones and computer. And in remote area, usually people, they don't have access to such things, such technologies. And also if he happens to execute this project, it will be a very costly. And also due to the mindset of people for a new change, it becomes difficult. And usually because of the very low literate rate, because of very low, people are not that much educated, and they does not adhere to the new changes. It's a weakness. And for the opportunity, with the introduction of telemedicines in these remote areas, there will be opportunities for different varieties of vendors. Like also government can intervene in establishing such. And I think one project has already started. And secondly, there will be a scope for international aids and partnerships. Also, there will be a rapid advancement in communication technology. It would provide opportunities for provide continuous medical education and training through the data. And also it would enhance the capability to manage the pandemics and other public health. For example, like before last year during the COVID pandemic, if these were there, then it would have been a very helpful for all the citizens that lives in remote areas, for proper care, for proper healthcare and all. And for the threats, like for every technology, there is always a risk for cybersecurity. So this is the main threat. And also sustainability, funding sustainability, because our country is a developing country. There is not much development in economic, and there will be equity issues, full access to each and every one of the citizens. There will be a lack of clear regulations and policy governing telemedicines because it's a new project, that's why. And also because of the too much of technological dependence, people will lose, in their capability to work. And it's finished. So these are our threats, strength, weakness, and opportunity with the introduction of telemedicines in remote areas. And our group comprises of like Sonam Tenzin Pelmo, Tringdoji, Bobisha, and Karma Dendu for group 1. Thank you.
Okay, thank you very much for your presentation. Okay, so after I take a glance on your SWOT analysis, in my opinion, for your strength, it's more like the advantage of the telemedicine if you develop in your own country, right? This is the advantage. However, for the strength, in my opinion, it should be like the strength of the Bhutan to develop the telemedicine. What is your resource that is your strength to start the project of the telemedicine in the remote area? Can you define it? Because more of this, it's just like, the advantage of the telemedicine, the good points. However, what is your strength in Bhutan to start for the telemedicine project? For example, like, okay, you have the specialist enough in your own country to just like give the consult when you have the develop the telemedicine system in your country, something like that. You get what I mean? The strength,
yes, madam.
the strength of yourself, the strength of yourself.
Oh yeah, madam. Yes, madam. I would like to elaborate that. Right now, our country has established a medical college whereby they are training a clinician doctors for the further specializations. With that, they are planning to with collaboration with like university, medical university and the Ministry of Health, they are planning to introduce such telemedicine in Bhutan. And there is already one project, one pilot project they have introduced for like ICTG machines. Have you heard of that one, madam?
Yeah. So in that case,
pilot project, they are trying to like cross-check the feasibility and the sustainability, how it would be possible for the country like us, developing country like us, can sustain such concept and all, ma'am.
So it
and
means
also
like
for the fund, also for the fund, yes, the Ministry of Health is collaborating with like UNDP, UN agencies and all for the support and all.
So it was like that your strength that your government see the advantage of the telemedicine at that your country wants to develop the telemedicine in your remote area, right? I think that this is your strength because of the, the government care have the vision on that way. And also the doctor and the clinicians, they are familiar with the telemedicine. Maybe it's one of your strength, because some of the countries, sometimes the doctor just like, they disagree with the telemedicine, something like that. Maybe it's your strength. Or also because of you have the the low population number, so it may be easier to educate them and promote for the telemedicine. It can be your strength also, but I'm not sure because I rarely know about your background, so I think that you can define more about the strength of your own country, because the thing that you already written now, in my opinion, is more like the advantage of the telemedicine, but it's not defined exactly on your strength. Okay. And for your weakness, okay, of course, that if you want to develop the telemedicine in the rural area, the infrastructure is the main problem. The infrastructure included with the electricity and also the internet, especially with the in Bhutan, you have like the the mountain areas, so it may the big weakness that you have, and also the low penetration of the smartphone and the computer. So it would be the limitation in the case if you develop the telemedicine in your country, because even the system is there, but the people or the patient don't have the device by oneself. So it's gonna be a kind of problem because the system is not gonna be implement effectively. And then okay, for the resistance of change, what exactly mean for the resistance to change?
Resistance to change specifically
Yeah.
means, in our country, usually in the remote areas, people are not that well educated, and they doesn't, really take up the new changes, such as giving health access through, via telephones or emails or video calls. They don't really trust such things happening online. What they want is to have a doctor at the front,
Okay.
getting checked out and like that. So for such new changes, that they don't easily, take up, they don't trust such changes, it's what
Okay,
it's
they prefer
resistance.
that to see the doctor in person
Yes,
instead
yes,
of
yes.
just like talk to the doctor on the screen,
Yeah.
thing like that, right? Okay. And
Moreover, they don't believe, the diagnosis done over online and all. So they are very reluctant to change. Yeah.
mhm. Can I ask that what kind of the population that you are having right now? Because in Thailand, for the elder people, sometimes they have like that same problem because they're not familiar with the technology, they're not familiar with the change also. But for the young people, they are different because for the young people, they are familiar with the new technology. So maybe the the population criteria may be effect to your technology consume, something like that.
I exactly don't know the population, the
Mhm.
adult population right now, but yeah, approximately, I think 40% of groups belongs to, age over 60 and all.
Okay. So it may be the weakness also because the reason for resistance of the change, normally it happens to the elder people.
Yeah.
And for the okay, external factors of the opportunities, okay, the government support, the international aid of the partnership. So it means that, okay, right now you have the international partnership and you always get some of the international grant to support in your healthcare
Yeah.
system. Am I right?
Yeah, ma'am.
And how about the medical devices system in your country? Can I ask more for information?
Yes, ma'am. Are you referring to the medical equipment management system?
So
We have
okay, go ahead.
we have like recently developed a centralized, computerized medical equipment management system in the country, and also we have like for the medical equipment, other than the medical equipment, we have a government equipment inventory system, and through that we track like breakdowns, status of the medical equipment, and the stock of the spare parts and all that.
And for the situation of the telemedicine, as you saw on the presentation in the morning, not only the equipment that in the hospital, however, for the patients who stay in the at home, sometimes you need the home use equipment, because sometimes you need to measure some of the vital signs and can, you know, transfer some data. That's why the doctor can use the telemed system.
Oh, so are you
for
referring?
consulting.
So are you referring to the patient data?
Yeah, something like that.
Oh,
Yeah,
okay.
because
Oh, yeah, we have
if you
like
don't have the home use equipment in your in at home, sometimes it's more difficulty to the doctor to give the consult and make the decision on something, because it's a basic data that you should have, like the basic vital signs that can transfer the data to the doctor. And then after that, okay, the doctor can give the consult online via the telemedicine system.
For now in Bhutan, we have like EPS, Electronic Patient Information System, managed by the government of Bhutan, Ministry of Health. And we have just integrated the data for the hospitals, and apparently we don't like we haven't integrated like personal equipment in that system, so I think it is not available now. But however, those patients visiting the hospitals in the country, their informations are all stored in that EPs in the server, and based on that, the doctors monitor them. Yeah, that's how it happens in Bhutan.
Okay. So you have some comments, right?
No, hello.
Yes, sir.
Good afternoon. I would like to know about the basic information of the Bhutan. The first, I would like to know about how about the ratio of the senior population and the young population of the Bhutanese.
Oh,
I would like to know the ratio.
Ratio. I'm sorry,
Ratio
I
between the
exactly cannot
elderly
comment
and
on
the young.
this one.
How many percentage of elderly population of Bhutan?
Because of, as I mentioned before, because of in Thailand, we are becoming to the elder society. So the number and the percentage of the elder people is more than the young people. And it reached to another problem like
I exactly don't know the ratio, but yeah, probably the ratio of elder would be a bit higher than the younger ones.
The second question I would like to know about in your country, do you have the healthcare accreditation system?
Oh yeah, I think so. There is. Yes, there is one like Bhutan Medical Health Council established in Bhutan. I think the name has been changed recently. The name would be, I think I forgot. And that's the main governing body for like clinical in Bhutan, clinicians.
In Thailand, we start about the biomedical engineering or biomedical engineer, or the role of biomedical engineer with the, I think the important factor of in Thailand, which can change from the traditional medicine to be the modern medicine, is the standard which we call hospital accreditation. In the hospital accreditation, we have the requirement about the personnel, in the doctor, in the nursing, and in the also in technology, and also including in about the biomedical engineer. Every of the factor have to be standardization. So if you have the system, I think is keep your work easier in the future.
Yeah. Okay, for the hospital accreditation and standards, I will give the lecture in next week for sharing for the Thailand system to you guys. Okay, it will be another sharing in when I give you the lecture on that topic. And then another, can you just go lower for the threats? Okay. So of course, the cybersecurity risk is always the main topic when you're talking about the telemedicine and technological dependence. It's okay because this thing sometimes you cannot control. However, it's a little bit, controversy because I think that the cybersecurity risk sometimes we can control. If we can control, it can be the internal factors, not the external factors, And of course, for the funding, sustainability, we cannot control it because we don't know when the monies comes. And okay, for the lack of clear regulation and the policy governing, if you take a look that yourself is Bhutan, I think that this one can be controlled because everything is under the Ministry of Health, isn't it? For the policy,
Yes.
am I right? Yes.
Yes.
Okay. Why I define on this? Because from the weakness and the threats, we're gonna reach to the pain point of the topic that you picked up. And then you see the pain point. You want to solve the problem, right? From the weakness. Then from the problem solving, you need to develop the process, you need to develop the innovation, or you need to develop the things to solve the pain point. And that's why another question will be, okay, if we develop the policy or if we develop the process, if we develop the innovation, is it worth it? So that's why you go to the lean canvas. So it will be more clear. So that's why after you go to the SWOT analysis right now, you need to make it clear what thing that you can solve by yourself and what thing that, okay, it's just like the threats that you cannot solve, but you need to keep eye watching about it and need to be concerned. Do you get what I mean? So that's why we start with the SWOT analysis. Okay, however, thank you very much for your presentation so we can see some of the perspective of your healthcare system. Okay, thank you very much for Bhutan number 1. And
Thank you.
The another group is the Bhutan number 2. Are you ready today? For the SWOT analysis presentation, you will be the last group of the SWOT analysis presentation. The Bhutan number 2. Are you here, the member? The member of the group Bhutan number 2, are you here? Okay, you still keep quiet. So, okay, maybe you are on the duty or something. And then if you get ready for the presentation, okay, you can do it later. However, just send the SWOT analysis document to our WhatsApp group, okay? And then for the next step, right now we have 6 groups, right? So who want to be the number 1 to present your pain point that you think that you're gonna solve that problem? Which group is ready? So you can share your slide. Hello? Which group is ready for sharing? After you did the SWOT analysis, just do it. Okay, so please, Deepika from Mauritius. Okay.
Good afternoon. Good afternoon, everybody.
You can share your
Hello,
slide if you
can
have the
yes.
slides.
Can everybody see? Can you all see? Hello.
See, yet we can see your sharing. So go ahead.
So I am from group number 2, and our SWOT analysis topic was repair and maintenance of medical equipment. And after a brainstorming session with all the group members, we have selected 5 of the problems from the threats. And the first one is high dependence on external suppliers for spare parts. Second is rapid technological advancements making equipment obsolete. Third one is unavailability of spare parts and high prices. The fourth one is geometric constraints. And the fifth one is limited availability of specialized training programs. So this is a brainstorming that we did, and we will select 3 of the more important points to make the lean canvas.
So what is your idea from your pain point? What do you think that how to solve the problem? How? Do you have any idea? Because right
Okay,
now
so,
for the external supply and spare parts, how you solve the problem about that? Or with the rapid technology advancement, making the equipment obsolete?
okay. Yeah,
So,
some of the ideas are like to have medical equipment which are modular. That is, when there is an upgrade, we can replace the module and continue using the same equipment. And then the second one is like to have subscriptions with probably the representative or the distributor of medical equipment. So that we don't own the equipment, we just rent them, and when there are upgrades, we can it will be like an exchange basis with the distributors.
and on the third one, for the unavailability of spare parts and high price, how you solve the problem? Because I think that this one is not the weakness. It seems like more threats because the thing that you cannot control.
Okay.
So after you ask yourself the question, so you can see more clear the thing that you can solve and the thing that you cannot solve.
Yeah,
Okay.
we are yet to select the 3 points that we are going to make final. So, ma'am, I have a question. We have to
Yes.
make one lean canvas with 3 of the problems, right?
Right. Or maybe you can add more weakness that you can see, and then you present the problem. You can add it more, because after you finish your SWOT analysis and then for you going to the next step, if you cannot go for the next step, maybe you have not enough information or you cannot solve the problem. So maybe you can go for another analysis and you can add it more. No problem with that. And for the repair and maintenance of medical equipment, do you have the problem with the delay of the maintenance or the repairs of your medical device? That, the user complain that, okay, why is so slow? Because of we waiting to be just like now time too long, something like that. So okay, on that way, maybe you can just like do the management or develop the process to make it more effective. This is more like example that I am trying to give for the repair and maintenance of the medical device in your department or in your country.
Okay.
How to reduce the downtime, for example. So you can use the lean analysis to develop the system to reduce the downtime, for example.
Okay, sure.
Do you get what I mean?
Yes.
Yeah. So you can
Hello.
make it clear more. Yes.
Hello.
Mr.
Can I
Amal.
join with you? Okay.
Yes,
Yeah.
Mr. Amal.
Yes. In the our weakness, geometric constraint, we hope to do some training. We can give some training to. Can you hear me? Hello. 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 Hello.
We can
Yes,
hear you.
we
Okay.
can hear you. We can hear you.
Okay. Right. We can train the nursing staff or the healthcare professions because I mean the geometric constraint is in our area we have to travel 1 or 2 hours for the hospital. In my area, I have 3 base hospital and 11 DH hospital likewise. So we get more time to travel and done repair. Sometimes that repair is like accessories. We have to replace only accessories. So they ask us to do repair. So I think for that we can train the healthcare staff and we can get basic troubleshooting from them. Then only we can go there and do the solution. And also we can keep some accessories with them and we can ask to replace the accessories, the problem solved or not. Likewise, that is the thing I think to do that one.
Yeah, that is just like the idea of your
Yes.
problem solving. So you can add in your just like making some project to reduce the problem. So you can write it down and just explain. And from that, you can use the lean canvas that already given the lecture on the yesterday. So to go on your project, okay? But right now, I have some idea about your problem solving. So just continue on your work. Okay.
Okay. Right.
Okay, thank you. Then
Thank
the
you.
next group, please.
Okay, thank
The
you.
next group, please. Oh, Deepika, do you still want to present?
No, that's fine.
Okay.
Thank
Okay,
you.
thank you very much. Okay, for the next group, the group number 2, are you ready? The group number 1, Naburu, are you here?
Yes, we are here, Prof. We are not ready. We are just
You are
polishing.
not ready yet, so that's why you keep quiet.
Yes, that's why we are
Yes,
quiet.
yes.
Okay, which one is ready? Which one is ready? Mr. Awa, are you ready from Ghana? Ghana team, GMMR, are you ready?
No.
No. Okay, from Fiji team, please reduce. Okay, Ghana, are you ready?
No. No, please.
Okay.
Already yesterday, because of the power outage,
Uh-huh.
I didn't talk to my colleagues.
Okay, you are still discussion, right, with your team? Okay, so from Fiji, are you ready? Fiji, are you ready? Okay, it seems that no one's ready. How about Pakistan?
She's in the same group as me.
Oh,
group
you are in the same group with Marisha. Sorry. Who's else? Okay, I got the message in the group. Okay, let me take a look. Okay, Mr. Amal already sent the presentation, so we're gonna define it and we feedback to you later, okay? And the rest of that, group number 1, Naburu, Namibia, Burundi, and Tanzania. Are you here? Oh. GMMR, no, not yet. Bhutan, okay, you can continue your work. The Bhutan 1 and Bhutan 2. Fishy? Fishy, are you here? Okay. Today it's just like no one ready. Maybe you need more time for your assignment work. So in the case if you're not ready, it's okay because today we're gonna give you the time for the group working. But tomorrow in the afternoon session, please go back to us and we're looking forward to see your lean canvas of your project. Okay, then tomorrow we're looking to see the lean canvas of your project that you want to develop to solve your problem. Okay. Okay. And then if you have no more presentation, so today I will give you some more time for the group working and discussion. However, tomorrow in the morning, we still have the lecture at 9 a.m. until 11 a.m. And tomorrow, I would like to invite all of you to join us on the live lecture because the guest speaker that we invited, he is a famous on the healthcare, especially in the community healthcare. So you will get a lot of knowledge and the perspective of the community care in Thailand. So tomorrow we will see each other at 9 a.m. in the morning and would love to encourage all of you guys to join us the live lecture. Okay?
Okay. We will join in the morning.
Okay. Sorry that we need to set up the class on the Saturday. However, you will be free from your job, so you can join us for the online and practicing class. However, you're gonna have the day off on Sunday. So sorry for the tight schedule for that. Okay. In the case if no one have the presentation on today, so today we may finish more earlier and then see you again on tomorrow with your assignment work. Okay. So we give you more time and then just try to discussion with your friend and do the group working from the group of Amal. I gonna get back to you after we take a look on your document that you sent us in the WhatsApp group. We will feedback. Okay. Thank you very much for today and thank you very much for our dean to join us today that you are give us for your valuable time to join us. Thank you very much for all your guys and do the hard work and get back to you tomorrow. See you.
Thank you very much.